Hi everybody, thanks for taking the time to look over this video. Today I'm going to talk about really four muscles that you can work on yourself that are really good in helping alleviate kind of sinus pressure and even more specifically possibly the symptoms of allergies. So those muscles are your SCM, which are here along the side of your neck, your masseter, which is kind of your big jaw muscle along the side. Then we have zygomatic, which is kind of along and under the cheekbone, and ocularis, which is right here. So if any of you read my email, you know that I found out firsthand what can happen when these muscles get irritated. And it can seem a lot like allergy symptoms. And what it really comes down to is poor posture, so maybe sitting at a desk kind of hunched forward or looking down a lot. And then eye strain, amazingly enough. With all the hours we spend on a computer or on our tablets or iPads or whatever, our eyes actually get strained from that. And that's the ocularis muscle that gets the eye strain. So what happens is it's kind of this domino effect. First of all, the SCM gets tight from looking down or looking forward, and then it causes trigger points up into the face. So this masseter, maybe a little, and zygomatic, which is under here. The zygomatic muscle actually causes a trigger point that can produce mucus, which may be the big factor as to why it feels like allergies, because the zygomatic creates that mucus. And then if it's eye strain on top of it, then your eye may start to water, one or both. So here you have this whole network of, oh, my face and my sinuses start to hurt, and then I have more mucus than I'm used to, and then my eye is tearing. Well, gee, that sounds just like allergies to me. But it could just be a set of trigger points that you have that if you work them out could alleviate the discomfort that you're getting. So I'm going to show you how to do that. It takes a few minutes to kind of learn how the muscles work, you know, how to work them best, I should say. So what position you want to have your body in when you're working. But it's not hard, and a little practice goes a long way. Of course, if you can't get them, you can always come in and see me and I can work on them for you. So the first muscle we're going to start with is we always like to start with kind of the muscle of origin. So what muscle is really at the root cause of a lot of these problems. So we're going to start with the SCM. So what you can do is if you want to work on your right SCM, use your left hand. You're going to put it across the kind of the front and the side of your neck. And then to find it, you know, it's this big chunky muscle. When you turn your head, you'll feel it move from side to side. So this big chunky muscle goes all the way from your ear down actually to your clavicle, your collarbone. So what you're going to do is you're going to get a hold of that muscle. You're going to squeeze it kind of in a motion like this, okay? So get a hold of it. The average person, just the average Joe walking around, has got 3 trigger points in their SCM. So I usually like to start not way up at the top, but just a little bit down. So you're going to grab a hold of it and you're going to kind of squeeze. And what you want to look for is you want to look for anything that's tender in that muscle. So just squeeze it a little bit and work it. Now you might feel like what we call a referral. So when you squeeze that area of the muscle, you'll feel kind of a tingling or a numbness or sometimes an even painful feeling somewhere other than where you're pushing. So like right now, I'm pushing here and I can feel some pressure in my ear, okay? So kind of look for a spot. If you find a spot, just try to hold it. You can do really little movements when you work out a trigger point. So I'm talking little. This is little, okay? No big movements like this. You want to just really little movements. And you want to hold that same spot at the same time, okay? You want to hold it and work really like you're just kind of rubbing that specific spot, but you're just doing a little motion, okay? So then go ahead and move down a little bit more, maybe a half an inch or something. And then you're going to search again for those tender spots, just moving your fingers really slowly. I mean, 1/4 of an inch can make all the difference in the world when it comes to finding a trigger point. And if you're not finding much, just keep massaging it. Not everybody has painful trigger points. Sometimes they'll feel knotty. A trigger point might just feel like a tight band in the muscle, and you may not feel like a little node or a tender spot. So just stay with it, okay? And then move down again a little bit more. The thing with trigger points is trigger points are in the belly of the muscle. So not at the beginning, not at the end, in the belly. Well, I should correct myself. There are trigger points at the beginning and the end, but the ones that cause those trigger points are all in the belly, the big piece of the muscle. Okay? So, did you finish that spot? Remember, you can come back and you can watch this video as many times as you want, and you can work on it again, okay? So normally what you do is you'd work that out, spend a couple minutes. It doesn't have to take very long. And then you would switch sides, okay? So it's good to do both sides. If you're not sure if one side is particularly tight, you can kind of go and look in the mirror and say, well, is my head turned to one side or is it turned to the other? Whatever side your head is turned to is the side that's tight, okay? Even if you feel more restricted one way or the other, it doesn't matter. The side that your chin is turned towards is the side that's tight. All right, again, if you don't know, just work both. You'll still get benefit out of that. Then we're going to move on to masseter, which can give you jaw pain too. Haha, how about that? Fun. So what you want to do is you want to find your masseter. It runs about from your cheekbones down the whole length of your jaw. And not up in front. It's really back along the sides. So when you work masseter, one of the easiest things to do is to just gently close your mouth. You don't have to clench your jaw. In fact, that can create trigger points in your masseter. But you just want to gently close it. And then you can take one hand and kind of stabilize it like this, and then work the opposite side. So you're going to take your fingertips right here, just under the cheekbone. And then you can do little circles all the way down, moving like just 1/4 of an inch, 1/8 of an inch at a time. So you're doing these little circles and then you're just moving down. And if you find a tender spot or a tight spot, then you can sit and hold that and just do kind of back and forth a little bit. That little massaging motion where you're trying to work out that really tight spot. So, and then you want to work all the way down to the jaw. So you're working from back here to the ear to about just under the corner of the eye. So through there, you should be able to feel it. It should feel like there's something there other than your teeth. So you work through there, okay? A lot of the tight spots are kind of up here along the cheekbone, and then further down, as you get further down, about right in the middle, right in that belly of the muscle I was talking about. And then another really good one is right along the edge of the jawbone here. There can be a tight spot. And it's not necessarily that this is masseter, but we're in the vicinity, so we'll work it out anyway. So it kind of feels like a band or a little lump that runs up and down that I can get my finger over. So I would recommend working that. And then once you do that side, go ahead and switch sides. So you're going to gently close your jaw, put your hand there to stabilize, and take the opposite hand to the opposite jaw. And do the same thing. Work through that. Okay? And then, so that's masseter. And then we have a zygomatic. Okay? It's this big cheekbone muscle right here. Okay? But there's two ways to work it. You can grab it like you do your SCM, where you get the big chunk, like this. But my preference is actually to use my fingertips. Okay? And then what I do is I work on top of the cheekbone like this. And then I get under the cheekbone. So I come from the bottom and push up towards the cheekbone. It's up and in because the muscle runs under this part of the cheekbone. So you're going to get those fingers up and in and slide them along right under that cheekbone. And you can start real close to the nose if you want. And you might start with your hand more in this position. And then you can turn your hand a little bit to get up and under. And you're going to be like, ooh, wow, I didn't realize that was so tender. And go slow. Again, that 1/4 of an inch. You can do those little circles like this. And then you can work all the way back. Usually about the corner of the outside of the eye is about far enough, because then you run into masseter. So that's usually about good enough. Let me tell you, you could save money on on blush. Just massage your zygomatic every day. It'll get nice and pink. Okay, so I hope that makes sense for everybody. Zygomatic is probably one of the most important. I mean, SCM kind of causes everything, but zygomatic is where you're going to feel like you're getting the most benefit out of massaging it. You're going to feel like it's tight, it's restricted, maybe there's some little lumps in there that you can work out, like little bead or pea-sized lumps that you'll feel. Just little circles, little movements, get them moving. You know, get that blood in there to break those up. And then the last one we're going to talk about is ocularis, which is the eye muscle. So you can imagine spending hours staring at your tablet or your computer, your iPad, whatever. You squint, right? Your eyes get tired. I mean, hours of that, it's no wonder. And that's the trigger point that can kind of make you feel like either your eyes are watering or that you have like that allergy, that dry eye allergy. For me, like if I put my contacts in the morning, I'm like, I know they were clean, but they still feel like there was something on it, or it's that dry, almost irritated allergy feeling. Then I know it's my ocularis. So what you do is you work along the bottom of the eye. Don't stick your finger in your eye, preferably, but it's along the bone there before the eye socket. So you can start as close to the midpoint of the eye as you want there. But what you're going to do is just push down against that bone. And you might find that it's pretty tender. Or you might find that it's okay for the most part, but you have 1 or 2 kind of restricted areas or little knots in there. But just working that whole length of that eye is incredible. I mean, I've woken up in the morning and felt like my allergies were acting up a little bit and my eye was a little itchy, a little dry. And I've worked out the ocularis and it's been gone in minutes. So I didn't have to put any eye drops in, didn't have to re-rinse my contacts, just massage that ocularis a little bit and it may go away. All right, beautiful. So if you found this helpful, please share it with somebody, because maybe some of us are taking allergy medicine that we don't really need. All we need is about 5 minutes of TLC on these eyes and on this face to make our allergy symptoms go away. And wouldn't everybody like to take less medicine or as little medicine as possible for something that's not really truly an allergy issue? If it's just tight muscles, if you massage the muscles and it goes away, then you know, like, oh, maybe I don't need to take that Claritin, or maybe I don't need that Sudafed. Maybe I just need to spend a few minutes massaging my eyes or take a break from the Candy Crush I was playing. So thanks for watching. Again, please share it with anybody that you think might get something out of it. And worst case scenario, if you're having trouble, you can always come in and see me for a session.